Allergy Action Ireland is calling for allergies to be recognised as a serious public health issue after addressing the Oireachtas Health Committee this week. And joining us now is Sheila Downes from Clare. She's mum to Josh and Erin, both of whom live with multiple severe food allergies and must carry EpiPens at all times. And since 2023, Sheila and her family have been travelling to France to access oral immunotherapy treatment, care that's not widely available here in Ireland. And who better to speak to get a sense of just how serious a health issue, indeed a public health issue, allergies can be. Sheila Downes, a very good morning to you and thanks for coming into the studio.
Good morning, Alan. Thanks very much for having me in.
So I mentioned your two sons, Josh and Erin. Josh is 11 and Erin is 7. Talk to us a bit about them and the allergies they live with day to day. And for those of us who don't have, food allergies or severe allergies, have they always had them? Are you born with them? Is it something you develop as you get older? How has it been for them?
Yeah, so I suppose for Josh, he's 11, and where we first encountered his allergies was when he was 2 years of age. He was eating foods that he would have eaten, I suppose, all his life up to that point, and he suddenly and very dramatically went into anaphylactic shock at home. And we didn't know it at the time, but it was in response to chickpeas and lentils. So unusual allergens in terms of the 14 known allergens. But that's what triggered his first anaphylactic reaction. He had eaten all of these food products up to that point previously and hadn't had any reaction. So we did not know what was happening at the time and needed to call an ambulance, 999 emergency call. And thankfully they did reach us quite quickly. We're very lucky. We're based in 6 Mile Bridge, so we're near enough to Limerick, to the University Hospital. But that's not the case for most people, as you know. Someone who might live in West Clare or, any parts of rural Galway, Mayo, up along the West Coast wouldn't have that direct access. One of the things I suppose we highlighted to the Oireachtas Health Committee yesterday was how we need better education, better awareness from our GPs and our primary care services in the community, because one of the things is you don't just generally have allergies on their own. There's kind of a holy trinity of eczema, asthma and allergies. And for, we'll say, Josh, our son, he would have presented with eczema from birth, really, and severe eczema. But at no point were we told that that potentially could lead to allergies. It's not necessarily that the eczema causes the allergies, but they're all linked. It's inflammation in the body. So I suppose we're asking for better awareness for parents and new parents of newborns in particular, to get them to introduce these allergens earlier in life. The knowledge and the scientific studies now have shown that if you introduce the likes of peanuts from about 3 months old, you could prevent that allergen from progressing.
So you can actually, okay, I think you're opening a lot of our eyes here this morning, Sheila, even the link to eczema. And you mentioned 14 different foods, and I mean for most of us, we're aware there are food allergies. The one that I think most commonly people think of is a nut allergy. Yeah. But like you even mentioning 2 things I love eating myself because I try to be somewhat healthy: chickpeas and lentils.
Yeah.
And it sounded like you were surprised to find out that there could be an allergy in relation to those. Talk to us a bit more. What other kind of foods do Josh and Erin have issues with? Yeah,
so for them, we have peanut, hazelnut, pecan, walnut, sesame seeds, kiwi, and then a slight, although not anaphylactic reaction to banana, which is a latex protein, which people again wouldn't realise is also in mango and avocados.
God, frustrating for a parent who was trying to give their children healthy food, being allergic to bananas, chickpeas and lentils.
Yeah, absolutely. Now thankfully they've outgrown that allergy, which again is unusual, but that's the nature of a child with these type of allergens. We're delighted that they have outgrown the chickpea and lentil food allergies, but we now need to keep those foods regularly in their diet. So for any parent that has a child with multiple food allergies, they know the kind of ongoing mental strain of it. You not only need to avoid some foods, but then your daily week you need to ensure that the others that they have outgrown or that they've got back into their diet, that they maintain that 2-3 times a week. So there's a significant balance there in terms of the allergens.
Yeah, so that constant vigilance, I'm trying to think of what a typical day looks like for you and your family. It must be really energy sapping, making sure that Josh and Erin, have their EpiPens on them at all times when you're doing, we were chatting off air beforehand, even doing the weekly shop, you probably are taking a more forensic approach to what's in certain foods that you're buying, looking at the back of the pack for the ingredients more than most of us. Can you shed more light on that, Sheila? What all the planning that goes into a typical day, or even a school day or a birthday party, the kind of planning, or trips abroad, how you and your family have to plan around those?
Yeah, absolutely, and you're dead right, Alan. It affects every facet and every part of our daily life. From I suppose when you get up in the morning, both our kids don't have the same food allergens or allergies. So there's different things that you need to look at in terms of the labelling on foods in the supermarket in particular, because everything now nearly says may contain or made in a factory where there may be nuts or seeds or whatever it might be that you're allergic to, and that's to kind of cover themselves. It may not be in the product.
But that makes it difficult for you, because it makes it feel as if there's a risk that everything could
Absolutely.
have a trace of nuts or something in it.
Yeah, I mean, there's some members on our group that have a lot more significant allergies than we have. They are very restricted in terms of the number of food products that they can give to their children. They're very restricted to named brands, so they spend a lot more money on their shopping. When we travel abroad, we have to be very careful in terms of looking up labels, using Google Translate to make sure that we're not misreading a label, because certain foods can have more common names in other countries. So you have to be micro-vigilant on everything you do. I suppose our fridge looks very different to other people's fridge. We've laid out what foods they can and can't have, the number of days per week that they're having the allergens that they need to keep in their diet, and equally then we're undergoing treatment in France to build up their tolerance and to desensitise them to their key main allergens, and those need to be microdosed every day. So again, that's another regime that has to be managed. Birthday parties, generally now we just say there's no birthday cake. We bring and make their own food in terms of a birthday cake or a treat that they'll bring with them. If you have a child that has a milk or egg allergy, that's even far more significant. I mean, you think of chips, all sorts of pastries, all sorts of milks, coffees, everything becomes a problem.
Rules a lot of stuff out, doesn't it?
Yeah, it's very difficult for someone with a dairy or an egg allergy, really, really significant.
And that level of micro-vigilance, as you referred to it a moment ago, Sheila, what kind of emotional toll does that take on you? And even with being as careful as you possibly can be, day to day, 24 hours a day, there must be the odd time where there's a slight mishap, or one of the lads accidentally eats something, and you have to either have the pens to hand, or rush them to hospital, or whatever might be involved in that, depending on how serious the reaction is.
Yeah, it's huge. The mental toll on parents of children that have allergies is really, really significant. And it's one of the reasons why we're calling for the government to recognise allergens as a public health and a chronic public health issue, because it's not just a life choice. It's not just, some people maybe perceive it as, oh look, they don't really like that food, that's why they say they have an allergen. That's not the case. It is life-threatening. So for a parent, if you accidentally expose them to something, allow them to have a bite of something that you didn't realise had the allergen in it, your heart stops, because the risk is within 15 minutes that child can go into anaphylactic shock and die. That is the bottom line here. They can stop breathing, they become unconscious. It's really, really significant. It can be that quick, or it can be delayed. In some of the allergens like hazelnut, walnut, the delay can be up to 2 hours. So you potentially, your child might have taken a bite of a sweet or something that might have contained hazelnut, chocolate, and maybe you didn't know. Then up to 2 hours later, you still need to be really, really vigilant, because at that point they could go into anaphylactic shock. So it takes a huge toll on parents, that mental load that they carry all the time. If you're away at a camp, if they're in school and there's some type of arts and crafts, again, if it's something like the egg or milk allergy, there could be residue on a table from the school lunches. It just affects everything. It never stops. The thinking about it never stops. Even
residue on a table, how could you even plan for that? That's a potential risk.
It is, yeah. So you would have, there's levels of severity, and that's why we're doing oral immunotherapy, because it builds up a desensitisation to the allergen. So you would hopefully that if you touch a residue on a desk, children by their nature, their hands are messy, they're going to get some of their food on their hands, then they'll touch another surface. If your child had that allergy and they touched that surface and then touched their mouth, you're ingesting it effectively, and you could go into anaphylactic shock.
And tell us, Sheila, about the oral immunotherapy. You've been travelling to France for the past 3 years. How did that come about, and how, maybe tell us a bit more about oral immunotherapy and how it has helped Josh and Erin?
Yeah, so oral immunotherapy is a medical treatment, a proven medical treatment that has been in existence internationally for about 20 years. So in Canada, in the US, UK, they have all been using this treatment for many, many years. And I suppose I got to a point probably the summer of 2023 after a number of near misses, different incidences that had happened. And I said, right, I just need to find a way out of this. Ireland really has a passive approach. It's prescribed. We prescribe EpiPens, we prescribe antihistamines and inhalers as your first aid emergency kit to carry around all the time. And I felt there has to be a way that we can treat this. So I did my own research and looked into the various countries that offer the treatment and felt that France was the best approach in terms of the speed at which they address the allergens, the kind of slow, proactive approach. So we travel to Lille in France every 6 months, and we've had amazing results. It effectively desensitizes and builds up your tolerance to the allergen. So for Josh, for example, he's actually removed now his sesame and peanut allergen. He can now free eat those foods. He's in maintenance for hazelnut, which means that 2 or 3 times a week he eats a hazelnut and a half. So he will never accidentally consume that quantity. He can actually consume more than that now, but that's his maintenance dose. So he's really protected that if he accidentally took a bite of, a Kinder Bueno chocolate bar, he wouldn't go into anaphylactic shock. And he's currently doing his walnut oral immunotherapy, which will also sort out his pecan. The same for my daughter. She has successfully completed her peanut oral immunotherapy. So from being anaphylactic to peanut, she can now eat 2 peanuts 3 times a week. Again, super protection. It is that's such an amazing,
transformative,
life-changing and life-saving. It really, really is. So it has been the best decision that we ever made in terms of taking our children to France. It comes at a cost. It's hugely significant in terms of times off work, time out of school, and financially the burden as well.
And I'm sure, for all those reasons, it's difficult. But also, you and your family must feel that at times, with all those issues, the financial costs and getting time off work, I'm sure you're just the be all and end all is you're delighted they're getting treatment that has been so successful. But you must think, why do we have to leave Ireland? Why do other families have to leave Ireland? We're being forced to go abroad for care that we should be able to access at home.
Yeah, and that was one of the reasons why we looked for the meeting and the presentation yesterday with the Oireachtas Health Committee. Nobody should have to leave this country to access treatment, life-changing, life-saving medical treatment that should be offered here. And I suppose there is a new pilot study that's been offered now in Cork out of CUH, but that's for under 5s, and it's just a pilot small study. But it is oral immunotherapy, and thankfully there is, we have a number of local people that are travelling to Cork to access that treatment, which is amazing. But there has been no new ring-fence funding for it by government, and we really need that. We need regional centres, we need better capacity in our regional centres, and we need early access to diagnosis and treatment. So right at the primary care level all the way up to tertiary. We shouldn't have to travel abroad at huge cost. And if you go back to your point on, traces on countertops, tables, you're asking small children and their parents to travel abroad in an airplane where they're frightened to travel because there could be that residue. They could go into anaphylactic shock on the flight. And you're saying that, well, maybe this is the only route, go and travel abroad and go on a plane and get that treatment. So we need to have the treatment available here in Ireland. We need to expand our paediatric allergy teams in terms of clinical nurses, consultants, and we need to provide ring-fence funding for that service. Of
course, to achieve all of that, Sheila, it requires turning the heads of those in power and getting them to do it. And a part of that process was, as you mentioned, you and Allergy Action Ireland at the Oireachtas Health Committee yesterday. How productive was that meeting, and has there been any sort of commitment to progress this matter, be it further meetings, or has there been any positive outcome that will give you hope that we will see a day when most families like your own won't have to be going to France or hopping on a plane to get the treatment that children, your family members need? Yeah,
so we were really, really happy with the Oireachtas Health Committee meeting yesterday and how it went. There was some fantastic interaction and questions from the deputies and the senators, and we had a commitment from the Cathaoirleach that they will write to the Minister for Health. And I suppose the issue being that it's been passed a little bit from post to pillar in terms of potentially that allergies should sit under Department of Education for children and schools, or that it should sit under the Department of Health. So there's a commitment there to request that, I suppose, the Department of Health really should take charge of it.
Yeah, it does seem, regardless of age, it seems more like a health issue than their children, so therefore it comes under the remit of education.
Well, it's adults and children, really. We have, I suppose, about 160,000 people in Ireland with food allergies, something like 1 to 2% of adults and 5 to 6% of children. And the prevalence is growing. And this is why we really need it to be identified as the Public Health Committee as a public health issue, because over the last 10 years, it's growing exponentially for a variety of reasons, really. So if we don't do something about this now, and if government doesn't react and call in the 4 key paediatric allergens in Ireland and get them to, I suppose, come up with a standardised care plan, come up with a national allergy strategy for Ireland, then we're going to see, really drastic consequences with the numbers that are coming through with these allergens. It's environmental factors, it's, gut health. There's a number of reasons why allergies are rising. So it will become a really serious public health issue if we don't address it now and enact change as soon as possible. We presented in a briefing pack yesterday a standard care plan as we see it, in conjunction with the Irish Food Allergy Network, IFAN, and that sets out kind of 3 key steps from primary to secondary to tertiary care, what we see needs to change and how it should happen. So that they have committed out of yesterday's meeting to bring in the paediatric allergens to discuss that with them and to look at a process for moving forward, which was great. Okay, so you have some sort of hope or optimism that we will see allergies being treated as a public health issue and see the kind of services laid out that your children and others require. Yeah, absolutely. Yeah, I think we're hopeful, and we will follow up with the members that were in there yesterday and ensure that happens in a timely fashion. Okay, listener wondering, and I think the answer to this might be yes, if the oral immunotherapy is possible for older people with allergies. Is it more effective when people are younger? Does that matter at all, Sheila? Yeah, so I suppose the effectiveness, they say the younger the better that you start, and that's why the pilot programme in Cork under 5, they want to get the children in as quickly as possible, because you don't want, it's the immune system has learned, if you like, that this protein is something that it needs to react to, but you can absolutely do it at any age, and I would urge anyone that is living with these serious life-threatening allergies to look it up to see where they can access this type of treatment. It can be as effective when you're older as when you're younger. Yeah, absolutely. Okay, we do have to leave there, but Sheila, thank you so much for joining us this morning, and it's clear from what you've described about your own family situation that allergies should be treated as a serious public health issue. From my own point of view, there's no doubt about that, and hopefully the positivity that came out of yesterday's Oireachtas Health Committee meeting will continue towards that path of the services like oral immunotherapy being rolled out more broadly across the country. Sheila Downes, thank you so much for joining us on Morning Focus. Thanks, Alan.